So, a fourth booster being given out. Is that because the third booster, the efficacy of that jab, declines pretty quickly?
Not really, and we don't know yet in a full extent. You have to remember that we started to vaccinate 60s and above end of July. So we are reaching now 6 months from the third dose. We do not have clear data yet, but it seems that there is a benefit of giving a fourth dose, including now when we are tackling the Omicron. We'll give it at this point only for the elderly population and for medical personnel. Actually, a preliminary decision was done yesterday, but it will take a few more days to go through all regulatory steps until we will practically start.
And is the fourth booster exactly the same injection as the third booster?
That would be the same. We'll give again Pfizer-BioNTech, which around 95% or more of our population were vaccinated with. I think in the future we would have to learn better about combination. And there are some signs that combining different types of vaccine may be beneficial. We don't have yet clear data for that. So at this point, we will stick to the same regimen as we did till now.
Now, forgive my ignorance, but is having 4 vaccines within 12 months perfectly fine, perfectly safe, no issues with that?
Of course, we have to test this issue, and it's a complicated topic for all of us, professionals and general public. And we could say after having a very meticulous study of the third dose, it seems to be perfectly safe. We have some signs that the fourth dose is safe as well. We took some measures, and we have now running these days a study in Israel of 2,000 individuals receiving the fourth dose, and by getting the final result, we would make a final decision.
There'll be a lot of people watching this thinking, you know, I've had my first 2 jabs, I then had a booster, I've had a flu vaccination as well, I now could be looking at a fourth COVID jab. When does this all end? You know, are we looking at a 5th, 6th, 7th down the line?
Well, I hope we'll end where we are with the flu jabs, meaning that every autumn we get an injection. Maybe it would be even available to combine these 2 injections to one, and that would be part of the autumn regimen of flu jabs. I do understand, all of us understand, that giving a shot every 6 months is a huge burden, both for us as systems and certainly for the public. So the basic idea, hopefully in the future, would be to be able to combine it with the flu jab. Now, it is a pandemic, and pandemics end. We can't say if it would end in the coming year, may take a bit longer, but certainly in a point we would go into a kind of a routine endemic situation, exactly as we have with the influenza virus.
Are you getting any vaccine fatigue from residents of Israel? People who are saying, look, I've just had enough of this. I've had enough injections. I've had enough of the jabs. I'm not going to go for a fourth.
That's certainly going to be a phenomenon. The majority of people who received 2 jabs got the third one. Still, there is a sub-population of people that had adverse events or inconvenience with the 2 first jabs and decided not to get a third one and are not now boosted. A fatigue of injection is certainly a thing that would happen. So, as I have mentioned, I do believe that we would have to find a way how to be in a regimen of giving a booster not more than once a year.
I noticed that in Israel, the first patient with Omicron to die was a man in his 60s who suffered from a number of serious pre-existing conditions. I mean, is there a chance that we're overreacting about Omicron?
Always is a chance. The problem is that when you are not only giving commentaries in studios, rather you need to take decisions as a government, you are standing in uncertainty and you have to decide. Now, hopefully, God forbid it will be differently, but hopefully it is going to be, I would say, a variant with not an excessive amount of severe and mortality cases, etc. There are some signs for that, but it's too early to say. And we have to take measures to avoid what is seen now in some countries, including in the UK, this massive spread of the new variant. And I think it's a bit too early to say that it is not a big deal. Most probably it's only, I would say, a mild form of this disease. And if so, even so, we would still see a surge in hospital due to the fact that we are dealing with huge number of new cases.
Yeah, a lot of debate, as I'm sure you've been following here in the UK, about whether we should bring in further restrictions after Christmas. Given Israel's experience, where would you say we're heading here in the UK?
Well, we are at the same boat, all of us, and we are sharing data and views with our British colleagues almost on a weekly basis. And I think you are somehow exceeding us in the wave of the Omicron. We'll see what is going to happen in the UK in the next 2 weeks, and that would influence a lot our own decisions. It would be the same in most European countries. I think at least the main countries in the continent are going to suffer from a massive wave of Omicron, and we will learn much more in the next 10 to 20 days.
Yeah, we're very much in that sort of watch and wait period, aren't we? Dr. Asher Salman, Deputy Director General of the Israeli Health Ministry, thank you very much indeed for your time. It's much appreciated.
Thank you.